One. You know, I kind of want to go back to the other room soon because I like the angle with the shop right in front of the logo. I noticed that was very clear.
You're gonna hear trucks.
Well, we'll decide. We'll decide last minute.
And bombs and construction and
because the sound interference in that room is like way too much. Yeah.
Well, we'll feel it out because this morning is silent. Mad quiet. No, it's
like boom,
shut up, India.
all that stuff. All right.
Am I straight? Crooked?
Yes, you're straight.
You're fine.
3, 2, 1.
Hello, everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now, in this episode, I'd like to discuss body aches as one of the CDC's 11 symptoms of coronavirus. Now, I've been asked by some of my audience as to why would someone feel body aches as a result of contracting this virus? Isn't a virus of this type considered a respiratory disorder? And why does my body hurt along with cough, fever, and sore throat? I'd informed them via chat on my app that the body aches in which one experiences as a result of becoming infected by this virus is as a result of muscle inflammation, which can be a symptom of a viral infection. There is evidence that the coronavirus can cause inflammation of the muscle tissue. Now, viral infections have been known to damage muscle fibers as a result of an inflammatory response to the virus. Now, inflammatory cytokines, which are introduced as a result of an immune response, tends to cause abnormal tissue breakdown. Basically, body aches are as a result of the immune system releasing special proteins called interleukins to fight against external pathogens. Whereas your body, once infected, works overtime to fight off this virus, setting off, as I've stated, an inflammatory response that results in body aches. Now, try and avoid self-diagnosing to the extent that you drive yourself crazy thinking you're COVID-19 positive because you're experiencing body aches. If you're experiencing body aches and pain, which are accompanied with fever, dry cough, shortness of breath, among other symptoms, contact your primary care physician to request COVID-19 testing to confirm whether you're positive or negative regarding the virus, because body aches can be a result of, let's say, exercise or overworking yourself physically or some sort of physical injury. So pay attention to the duration of the body aches, because body aches as a result of exercise can stick around for, let's say, approximately 48 to 72 hours, whereas body aches as a result of becoming infected by the coronavirus can persist for approximately 1 to 2 weeks in most cases. Now, some have asked if I treat body aches as a result of being infected by this virus, and my answer to them is yes. Now, when it comes to Chinese medicine, body aches can be diagnosed as what would be called B syndrome, which is usually the result of an invasion of an exterior pathogen such as wind, cold, dampness, as well as heat, which tends to obstruct the channels within the body, impeding the circulation of qi and blood. Now, exterior invasions are usually tied to conditions within the environment in which you exist. Cold and damp living conditions, rainy or cold weather, as well as working in water can obstruct the muscles and joints. Now, there are 4 basic acute patterns and 3 basic chronic patterns of B syndrome, or in Western medical terms, body aches. The 4 patterns of acute episodes regarding body aches in Chinese medicine are: 1, B syndrome due to wind, where there would be pain and soreness which would migrate between the joints. Symptoms would present as a version of wind, fever, and a limited range of motion. The tongue would appear with a thin white coating. Now, in this case, I would look to expel internal wind, unblock obstructed collaterals, disperse cold, and clear dampness. Another acute episode could be B syndrome due to cold, where there would be extreme pain in the joints and limbs, which is aggravated by cold. Symptoms would present as difficult difficulty moving, such as a result of stiffness of joints. The tongue would appear as moist white with, go back a little, I'll tell you to stop. Back more. Yeah, right there. Go.
3, 2, 1.
Symptoms would present as difficulty moving as a result of stiffness of the joints. The tongue would appear with a moist white coating and the pulse would be tight. Now in this case, I would look to warm the channels, expel cold, dispel wind, and eliminate dampness. Another acute episode would be B syndrome due to dampness, where there would be some swelling and heavy and painful joints and numbness. Symptoms would present as soreness and heaviness with fatigue and lack of strength. The tongue would appear as a white, let's say, greasy, thick coating, and there would be a soft pulse. In this case, I would look to eliminate dampness, dispel wind cold, and unblock the obstruction in the channels. Another acute episode could be B syndrome due to heat, where there would be some swelling with redness as well as burning pain in the joints that feels warm to the touch. And let's say this pain would be, go back to another. Why am I fucking up now? A little bit right there.
3, 2, 1.
Another acute episode could be B syndrome due to heat, where there would be some swelling with redness as well as burning pain in the joints that feel warm to the touch, with pain aggravated by pressure, but also relieved by cold. Now, symptoms would present as aversion of wind, fever with sweating, thirst and restlessness. The tongue would appear as red with a dry yellow coating, and the pulse would be rapid. Now, in this case, I will look to clear internal heat as well as unblock the collaterals, dispel wind, and eliminate dampness. Now, when it comes to diagnosing chronic active phases, there can be 3 basic patterns related to this phase, such as phlegm accumulation with blood stasis, where there would be a swollen, stiff, and painful joint. The tongue would appear as purple, but with a white, greasy coating and a choppy pulse. Now, in this case, I would look to transform phlegm, unblock the channels, and expel stasis. Another chronically active phase could be qi and blood deficiency, where there would be joint pain, numb limbs, lower back and knee soreness, and intolerance for cold with fatigue and shortness of breath. The tongue would appear as pale with a white coating, and the pulse would be weak. In this case, I would look to get rid of the wind dampness, unblock any obstruction in the channels, and tonify qi and blood and nourish the kidney and liver. Another chronically active phase could be B syndrome of the heart, where there would be shortness of breath with a pale complexion. The tongue would appear as pale or purple, and the pulse would be knotted. Now, in this case, I would look to nourish qi as well as nourish the heart, and warm the yang as well. Now, these are examples of how an acupuncturist may diagnose and treat body aches in Chinese medicine. Now, in my next episode, I will discuss headache as one of the CDC's 11 symptoms of the coronavirus. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours? Yay.